Hello, my name is Donà. I'm from the Medical University of Vienna. My colleague Christian Nietzsche and I performed a study assessing the prevalence of cardiac amyloidosis in patients with severe mitral regurgitations, as well as the outcomes after transcatheter edge-to-edge mitral valve repair. Our study was performed at two centers, the Medical University of Vienna and the University Hospital of St. Pölten. 120 consecutive patients were screened for cardiac amyloidosis using bone scintigraphy, echocardiography, as well as immunoglobulin light chain assessment. We were able to find 14 patients with cardiac amyloidosis, which equals around 12%, as well as 9 cases of early amyloid infiltration, which is around 7.5%. Independent risk factors for cardiac amyloidosis were increased posterior wall thickness, as well as the presence of a left anterior fascicular block in the ECG. Procedural success as well as peri-procedural complications were similar in both groups. However, we could observe that patients with cardiac amyloidosis and mitral regurgitation had a worse outcome, mainly driven by an increased prevalence of heart failure hospitalization, but comparable mortality. So in conclusion, cardiac amyloidosis seems to be of high prevalence in patients with mitral regurgitation. However, transcatheter edge-to-edge mitral valve repair is feasible in those patients, but patients with cardiac amyloidosis experience a worse outcome in comparison to patients with lone mitral regurgitation. We're very happy to announce that the paper was accepted at JACC Cardiovascular Interventions, and would be very happy if you could take a closer look at jacc.org.